Hurricane Laura was a massive response. We've got over 800 trained volunteers from across the country, including the ones from South Carolina that are there. We've opened shelters, and not only what's happening with Laura, right, but you got to think about the operation that we're doing right now in California as well with the wildfires. So Red Cross is very busy. We are ready for this. We're prepared for this. We've done a lot of work to be able to operate in a COVID-19 environment. I think for us, there's three really, really big needs. And I think if people look and say, hey, I want to help out the Red Cross, how do I do that? Three really ways to do that. The first would be a financial donation. We understand that people are super generous and sometimes they want to send, food or clothing or items like that. But because of COVID-19 and the difficulties with making sure that those are sanitary and safe and sorting those items, we can't really do that. So the best way to help us is giving a financial donation. You can do that at redcross.org. You can even text 90999, text Laura to 90999. Or you can call 1-800-RED-CROSS. Give a donation. All that money will go to help, again, in responses like this. It goes to being able to provide, whether it's a big disaster like Laura or a small disaster like home fire that we respond to on average of 6 times a day. So that's a huge way to help us there. The other way would be to volunteer, right? We're talking about volunteers that have been deployed down there. We have to have volunteers. They're really the heartbeat and the blood of the Red Cross. We can't do anything without them. So we really do encourage folks, if you're healthy, if you're eligible, and if you're looking for a way to give back, think about joining our team, redcross.org/volunteer. There's a lot of opportunities. We really encourage folks to look at, working in shelters, or if you've got a medical professional license, we're looking for, registered nurses to join our team as well. But there's a lot of opportunities. There's a lot of virtual opportunities. It's not just disaster response. You can help with our blood collection. You can help with serving our veterans and our military. You can help with our training services where we teach, things like CPR and first aid. So there's a lot of opportunities. So if you want to volunteer, please look at the options and consider joining our team. And then lastly, the other big thing right now, especially because of COVID-19, is blood donations. If you're eligible and healthy, and you're able to, please consider making an appointment to give blood. The blood collection has been a challenge for us ever since COVID really started back earlier this year. Drives have been canceled. Obviously, people are a little bit more hesitant to come give, and so we need that steady flow of blood donors. The only way that we can collect blood is from volunteer donors. So it's super simple. You go to redcrossblood.org. You can make an appointment. Please give blood. We need that constant supply because blood is a perishable. It's a perishable item. We can't stock it up and save it, and we have to have a constant supply of that to help, cancer patients, children that are battling a disease, anybody that's been in an accident, mothers that are giving birth, anybody that needs transfusions. We have to be able to have that blood. So if you want to give blood, that's a huge way to help us out as well. Not only are all of our volunteers have gone through some extensive COVID-19 procedural operation training, all of them have done that, whether they've deployed or not. So they've been trained with that. At our shelters, whenever we open a shelter, not only in South Carolina, but across the country, we're going to have new procedures in place at those shelters. We're going to be screening people, taking temperatures, asking those CDC questions before they ever come in. We're going to be reducing the capacity of shelters and having to open up more shelters so that we can allow for social distancing, spreading out those cots, allowing for more space in between each cot. Making sure we limit the capacity so people can spread out. Like I said, all of our staff, our volunteers, and anybody that's working in those shelters will be required to wear a mask. And we're asking anyone that comes to shelters, they'll also be asked to wear a mask. So if they can bring a mask, great. If they don't have one, they'll be provided one when they arrive at a shelter. We also have isolation areas set up in our shelters. Those will be a tool if there's someone that maybe has symptoms or develops symptoms or maybe has symptoms when they show up to a shelter. And we'll work with our health partners to deal with those kind of on a case-by-case basis. But there's isolation areas set up, hand sanitizing stations, cleanings in the morning and at night. Meal times are all different, right? We used to do kind of bulk feeding, right? Breakfast, lunch, and dinner, and kind of do a cafeteria style. We're not doing that anymore. It's all individually wrapped and packaged meals, staggering meal times. So the overall goal of this is to open shelters, provide people a safe place to stay, but to do it in a way where we're, again, limiting interaction, keeping people as spread out as possible to try to mitigate the risk of COVID-19. A lot of these volunteers with South Carolina have got experience with storms. I mean, over the past 4 or 5 years, South Carolina, especially, you know, along the coast in the low country, we've had some serious storms happen. And despite the environment that we're living in, despite what's happening in the world, you know, these 25 South Carolina volunteers, and there were many others, there's dozens of others that are on standby that have said, hey, raised their hand, said, hey, I'm willing to go and help. And we're just amazed by that. We're so grateful that our volunteers step up time and time again. They literally, some of them packed up within 24 hours and were willing to, you know, head towards danger to help others. And that's kind of what the Red Cross is all about. And we're just so thankful and appreciative to the volunteers, not only from South Carolina, but really across the entire country.